Well, I think there's a lot of political commentary around mental health and well-being in general, and people with mental health problems have been stigmatised for a long time. Communities fear them. In fact, black and minority ethnic communities fear people with mental illness more. They stigmatise them more than the white majority community. So there's a big challenge to improve education in the population around that. However, the wider political commentary about anything to do with culture, anything to do with race or ethnicity is a real problem. It's a real problem not because it's produced by patients and people suffering distress, but it's a problem of the political and social system we live in and the political attitudes and views of the wider society. We know that the way people adapt to their environment depends not only on their own resources and coping, but also the receptivity of the environment and receptivity of societies to accommodate their health and well-being and their needs. And we know currently there's not much leeway for accepting that race and ethnicity and racism are relevant factors in health and well-being. There's increasingly a move to censor racism, for example, as a relevant psychosocial factor, and censor the fact that race and ethnicity impinge on people's health and well-being. Not only as the individual feeling discriminated against, but also in intergroup relations and interpersonal relations, that somehow this does get into the quality of the relationship and the quality of social support that people can experience. Putnam, for example, in America has said that increasing racial diversity is problematic, that people prefer to live in isolated communities, and increasing racial diversity causes problems in societies. Well, we found the opposite, that increasing cultural diversity offers opportunities for building what's called bridging social capital between communities and between people, and that offers a unique opportunity to develop better social relationships and healthier social relationships and a more cohesive society. So I think we need to get away from simplistic notions of what is cultural and what is multiculturalism, and think more carefully about how to encourage people to adapt to different cultural environments. There's increasing migration, increasing globalization, so cultural diversity is not going to go away. Burying a head in the sand, trying to airbrush out the word racism from all policy documents really isn't an acceptable or reasonable way to address the problem. We need to accommodate the realities of what people contribute to our society and the challenges they face, and understand all people, patients and black and minority ethnic groups and gay and lesbian groups and all individuals who are socially excluded as legitimate citizens of society, that they should both benefit and contribute to society, but that we should be able to offer support to them if they're not able to contribute, or if their social capacity to be part of a society is limited due to illness or disability.